Hi, I'm Charlie Langdon. I'm going to demonstrate doing a dressing change for a chest tube. So the first thing you want to do is you want to introduce yourself to your patient in the room. You've done a safety check and you've explained the procedure to the patient. You've also brought your supplies as well. So now I just want to set up my sterile field very carefully. Be careful not to touch the 1 inch inside the 1 inch border. Okay, now I'm just going to take my sterile field extender and I'm not going to use it for this procedure. This is my garbage bag. I would normally set it up here, but I set up another garbage bag just to be instead of that. I didn't want to just overly ruin my garbage bag with opening it and reopening it. But this will suffice for that, I hope, if that's okay. Now I want to get my metal tweezers to the edge. I just want to use the tip to tip method. Tip to tip. Okay. And I also want to set up my supplies. So I've got some gauze sponge, which I'm going to wing out. Drain sponge, wing out. Really sticky sometimes. And my gel net. Again, using the wing method. Okay. Now I'm going to wash my hands. And I'm going to don gloves and I'm going to observe the chest tube dressing. That's there. So I'm going to take it off. Just being careful to stabilize the tube. I want to make sure that I don't use scissors to remove the dressing, as that can damage the chest tube. So I can try and pull it away in order to get it free. Oh, it's really on there. Just want to be careful that I'm stabilizing. Okay. Then what I want to do is I want to look at my dressing to see if there's any exudate, any color or smell of the exudate. So I see none in this case here. I'm going to take off the Jello net from the wound and dispose of that and the glue and my gloves here. Now I'm just going to observe the wound for any swelling or redness, any exudate, to get an idea of the shape of the wound or if there's any infection or what have you. So it actually looks very good there. So I'm going to go ahead and start cleaning the peri-wound area. So I've washed my hands again, and oh, actually, you know what? I'm going to prepare my sterile water. I would have done this normally when during the first initial setup, but I can do it now. I'll carefully add the water. Wash my hands again. And I'll start getting my rosettes ready. So I'm using the no-touch sterile technique for this dressing change. So I'm going to clean the peri-wound, the inner point doing a 360 single swipe. Do the same again. Going a little more outward. And once again. Then I'm going to make more rosettes for the chest tube itself. So I'm going to go above and below the chest tube. Okay. Now I'm going to use a 4x4 gauze to dry the peri-wound. So using the innermost circle. So I've dried the peri-wound now, and the chest tube itself is dried. I'm now going to prepare the jello net. Sometimes it's a little tricky to pry it free there. Okay, so I made it into a triangle to help get it on more easily. And now I want a sort of a tight seal around the chest tube. Okay. Now I'm going to do the drain sponge. I'm going to come at 2 different angles. And I'm going to apply my 4x4. And then I'm going to apply my Me Fix. So my Me Fix, I have the date, time, and my signature. I'm going to pull the Me Fix apart a little bit. In order to get it to a point that I can affix onto the dressing. Careful here. And I want to tent it around the dressing. That way it secures the tube so it doesn't come loose. Even though there's stitches there, you still want to secure well. Okay, so I do have the date, time, and my signature, and I've completed the dressing change. Thank you very much.